Welcome to today's podcast where we will be exploring the topic of heart murmurs. A heart murmur is an abnormal sound that can be heard during a heartbeat. It is typically caused by turbulent blood flow through the heart and can be indicative of a variety of different cardiac conditions. Heart murmurs can occur during different phases of the cardiac cycle, which can provide important information about the underlying cause. There are several different types of murmurs based on their timing. During the podcast, we will use S1 for first heart sound and S2 for second heart sound. First murmur we will talk about is pansystolic. These murmurs occur throughout systole from the S1 to the S2. The loudness and pitch of the murmur may vary during this time. Pansystolic murmurs are often caused by ventricular leakage such as mitral or tricuspid regurgitation or ventricular septal defects. Second murmur we will talk about is ejection systolic. These murmurs occur during the early to mid-systolic phase, with the intensity of the murmur greatest during this time and then gradually decreasing. They are typically caused by turbulent blood flow through an orifice, such as aortic or pulmonary stenosis, hypertrophic cardiomyopathy, or an atrial septal defect. Third murmur we will talk about is late systolic. These murmurs begin after S1 and continue until S2, with a noticeable gap between S1 and the onset of the murmur. They are often caused by mitral valve prolapse or papillary muscle dysfunction. Fourth murmur we will talk about is early diastolic. These murmurs begin with S2 and then fade away with a high-pitched sound. They are typically caused by regurgitation through a leaky valve such as aortic or pulmonary regurgitation. Fifth murmur we will talk about is mid-diastolic. These murmurs begin after S2 and may extend to S1 with a lower-pitched sound. They are typically caused by impaired blood flow during filling such as mitral or tricuspid stenosis. Sixth murmur we will talk about is presystolic. These murmurs occur just before S1 and are often caused by atrial systole increasing blood flow across the valve, such as in mitral or tricuspid stenosis. Seventh murmur we will talk about is continuous. These murmurs occur throughout both systole and diastole and are typically caused by a permanent pressure gradient, such as patent ductus or numerous malformations or fistulas. Eighth murmur we will talk about is combined systolic and diastolic. These murmurs occur during both systole and diastole and are typically caused by aortic stenosis and aortic regurgitation. Ninth murmur we will talk about is pericardial friction rub. This is a superficial scratching sound that can occur at any time in the cardiac cycle. A prominent characteristic of pericardial friction rub is its propensity to reduce in intensity when the patient assumes a sitting position and leans forward. The characteristic of pericardial rubs is that they are independent from respiratory movements, making this helpful in distinguishing pericardial rub from pleural rubs in the process of differential diagnosis. If you found this podcast helpful, don't forget to like and share it. And make sure subscribe to our channel for more informative content like this. Thank you for listening.